Hi, this is Mark Besser of Besser Healthcare. In this video, I will answer all the questions regarding how soon you can get tested for different sexually transmitted diseases or STDs after unprotected sex, and how fast STD symptoms appear, and our recommendation on how and where you can get tested. Either you want to know for sure if you are STD-free, or if you think you have an STD, with fast, affordable, and 100% discreet or confidential testing. Now, let's say you've recently had unprotected sex, and now you're worried that you may have picked up a sexually transmitted disease or STD. With STD rates rising higher than ever before, this is a valid and legitimate concern. So what do? Getting tested would be a very smart decision, but you may be surprised to learn that you can test too early. If you feel like you could have contracted an STD, your instinct may be to get tested immediately, but this can be a huge mistake. Testing too early can cause inaccurate results, possibly leading you to believe you're STD-free when you're not. This is because each STD has its own unique incubation period, which you must wait to get accurate results. Like many things in life, timing is everything. But why should you get tested for STDs? There are an estimated 20 million new sexually transmitted diseases and infections every year, and half of all Americans will contract sexually transmitted diseases or STDs before the age of 25. So, when should you get tested for STDs? The amount of time it takes for STDs to show up on an STD test varies because STDs have different incubation periods. What is an STD incubation period? An incubation period is the time from when you first come in contact with an STD to when antibodies form to fight the STD. Tests look for the presence of these antibodies during testing. If you do not wait until the incubation period has ended, you may not allow your body sufficient time to develop enough antibodies to show up in testing, causing a false negative result. Even after you have waited for the incubation period to end, you may not see the STD symptoms. Many STDs do not display symptoms or are so subtle that you think you have a cold or a rash. Your symptoms come and go, but this doesn't mean the STD has gone away. This is why it's important to get tested. There is no other way to be 100% sure of an STD diagnosis. How soon do STD symptoms appear? How long it takes for an STD to show up in testing is entirely dependent on the STD itself, how long its incubation period is, and your own body's immune response. You can test for some STDs, like Chlamydia, only a day after potential exposure. Meanwhile, HIV and Syphilis can take a month or more before you can accurately test for them. Chlamydia incubation period. Chlamydia is the most reported STD in the U.S. Anyone who has unprotected sex can get chlamydia. However, it poses the greatest threat to women. If untreated, chlamydia can spread to the uterus and fallopian tubes, possibly causing pelvic inflammatory disease, or PID, or infertility. The window period for chlamydia may range from 5 days up to 2 weeks. So, you should get tested 24 hours to 5 days from potential exposure. After being treated, it is best to test again 2 weeks after completing treatment to ensure the STD is completely gone. Gonorrhea incubation period. Like chlamydia, gonorrhea is an extremely common STD in the U.S. It's a bacterial STD that normally poses little harm and can typically be treated with antibiotics, but can cause greater issues if left untreated. Gonorrhea has an incubation period of only 2 to 6 days, so you can get tested for it shortly after exposure. Get tested 2 weeks after being treated to ensure that you are clear of the Neisseria gonorrhoeae bacteria. Pregnant women should consider getting tested for gonorrhea because it is one of the many STDs that can be transmitted during birth. If you would like to test for gonorrhea, consider also testing for chlamydia, as these two STDs frequently occur together. Syphilis incubation period. Syphilis is an STD that is infamous for being difficult to diagnose due to how common its symptoms are. So much so that syphilis is sometimes called the great imitator. Worse, these common symptoms typically go away on their own over time, yet the disease will remain. Syphilis can cause serious damage if left untreated, but this takes years. This slow progression is reflected in its incubation period, with the first symptom at 21 days, but can often range from 10 to 90 days after infection. So, you should get tested 3 to 6 weeks from potential exposure. You should retest for syphilis 3 months after treatment to ensure you're completely cured. Hepatitis incubation period. There are 3 types of major hepatitis: A, B, and C. All types of hepatitis cause liver inflammation and have similar symptoms, with the main differences between them being the recovery time and chances of developing into long-term infections. Hepatitis A will not develop into a chronic infection, and it generally heals itself in about 60 days. Hepatitis B can become chronic, and it takes about 6 months to recover from. Hepatitis C is very likely to develop into a chronic infection, and it can take months to recover from. The testing window for each type of hepatitis is as follows. The hepatitis A virus averages a 28-day incubation period. So, you should get tested 2 to 7 weeks from potential exposure. Retesting is unnecessary, since hepatitis A is a virus and remains in your system for life. Hepatitis B can occasionally be detected as early as 3 weeks after exposure, but for more accurate results, we recommend getting tested after 6 weeks from potential exposure. Same with hepatitis A, retesting is not necessary, since hepatitis B is a virus and remains in your system for life. Hepatitis C can be detected in 8 to 9 weeks after potential exposure. So, get tested within that time frame. Get retested after 3 months to confirm your initial test results. Herpes incubation periods. The herpes simplex virus or HSV can cause sores to appear around the mouth, genitals, and other areas. These sores are both irritating and highly infectious, and direct contact with them is one of the main methods for transmitting herpes. Because the virus can spread through kissing, skin-to-skin contact, and oral, anal, and vaginal sex, it is very common. Herpes comes in 2 forms, HSV1 and HSV2, which are sometimes known respectively as oral herpes and genital herpes, despite that neither type of herpes exclusively affects a single region. Many unknowingly carry herpes infections without issue, but there is treatment available to manage extreme cases for those who need it. It is best to wait 4 to 6 weeks after the potential first exposure to be tested. If you tested negative for oral herpes, get retested frequently if you have unprotected oral sex or come in contact with herpes 1 fluids like saliva or semen. Even if you tested negative for genital herpes, it is advised to retest after 3 months to confirm the initial results. HIV incubation period. Human immunodeficiency virus or HIV is an STD that destroys immune cells known as CD4 cells, a type of white blood cell. These CD4 cells are vital for the maintenance of your immune system. When they are destroyed, your immune system becomes damaged and unable to fight off diseases. HIV can be treated with HIV-specific medications known as antiretroviral therapy or ART, but if left untreated, the virus will almost always progress into acquired immunodeficiency syndrome or AIDS. AIDS is typically fatal. However, thanks to ART, it is possible to live a long, healthy life with HIV and prevent AIDS from developing. Our recommended HIV screening company offers 2 types of HIV tests. The HIV RNA test for early detection has the shortest incubation period. When tested using this method, HIV has an incubation period of only 9 to 11 days. HIV RNA tests have shorter incubation periods than HIV antibody tests because they search your blood for the presence of the HIV itself and not the antibodies to the virus. HIV antibody testing is the second method of testing they offer. Because this type of HIV test looks for antibodies, which take time to develop, it requires you to wait 1 to 3 months before it can show you an accurate result. Further confirmatory testing is performed on all positive HIV results, regardless of method. You can find the website link of our recommended HIV screening company in the description below this video, or go to bessercare.com/STDcheck. They have over 4,500 testing centers nationwide. Trichomoniasis incubation period. Trichomoniasis is similar to Chlamydia. Both are extremely common STDs that typically have very mild symptoms or sometimes do not have any symptoms at all. Unlike herpes, trichomoniasis is curable but only after being identified through testing. It normally poses little to no risk. However, trichomoniasis can cause complications in pregnancy. In men, Trichomoniasis can cause prostate cancer, infertility, and increase the likelihood of acquiring HIV. Unfortunately, the incubation period of Trichomoniasis is a broad 5 to 28 days. It is advised to retest after 3 months to confirm the initial results. How soon can you test for all STDs at once? I know it can be hard to wait to get tested. As soon as the thought crosses your mind that you may have an STD, you want to learn your status as soon as possible, but you know now that's probably not the best idea. You don't want to test too early, and you also don't want to have to visit the labs multiple times because of all the different STD incubation periods. To make it easy and only have to test once, I suggest waiting to test according to the STD with the longest incubation period. For example, if you wanted to test for every STD mentioned on this video through our recommended STD screening company's comprehensive 10-test STD panel, you would need to wait at least 8 weeks to get accurate results because that is the minimum amount of time hepatitis C needs before it shows up on tests. And now, onto our recommended STD screening company. Click the website link listed in the description below this video to see the list of their test centers in your area with the discount coupon. Or go to bessercare.com/STDcheck. Our recommended STD screening company makes getting tested for STDs a simple and convenient process in just 3 steps. Step 1. Order their STD 10-test panel or individual tests online or by phone. Step 2. Choose one of their 4,500 test centers nationwide. Testing only takes minutes. Step 3. Your test results are delivered in your online account within 1 to 2 days. The entire process is fast, affordable, and 100% discreet or confidential. Remember, either you want to know for sure if you are STD-free, or if you think you have an STD, you need to get tested as soon as possible. Don't delay. Thanks for watching this video. If you like this video or find value from it, please click the like button and let us know what you think in the comments section below. Or if you have further questions or want to share something with us in private, please feel free to reach out to us at mark@besserhealthcare.com. And if you want us to include a certain topic in our next videos, please let us know in the comments section below, or email us. Also, subscribe to our channel and click that bell for you to be notified of our upcoming videos. See you again in our next videos. Stay safe and healthy, everyone.